Hi, Doctor. Great to see you. Thanks for coming on.
Well, thank you.
Let's dive right in and talk about Coolsculpting. What is this procedure?
Coolsculpting is a brand new procedure that is completely non-invasive, that is used to reduce stubborn fat that we all have throughout our bodies.
Well, how does it work?
The way it works is that it actually freezes fat. So it's fat that can be pinched, and usually works in the trunk area. So abdominal fat, you know, the muffin top or the bra fat. There's a device that sucks that area in, then freezing starts. It freezes the fat, and you lose between 20 and 25% permanently. So full results are really visible in 3 months, but in about a month and a half, you start noticing that you're reducing.
Well, now, what are the treatments like necessarily? So you come into the office, kind of walk me through the process.
So generally when someone comes into the office, initially they come in for a consultation. So I evaluate them, talk to them about the history, their other medical issues, and about their weight gain, loss, their weight loss history. We want someone at stable weight, and we want someone who is in good health, not very overweight, but where I can pinch fat. So if I can when I'm examining them, actually able to pinch fat either in the abdomen or waist area, then they're ideal candidates for it. So it's both men and women.
Okay, now how many treatments would somebody need in order to see results?
It depends on the area we're treating. So for example, a woman, average size American woman, to treat both her abdomen and her waist, she would need 6 areas treated. That means 6 hours of treatment. She could do that all in one day, or she could divide it up in 2 days. So she'd do 6 hours of treatment, and 3 months later, she would be 20 to 25% less fat.
That's amazing. Now, I know you brought some photos, so let's go ahead and take a look at those.
Okay.
So tell me about the first photo that we're looking at.
So this is a patient who's had the Coolsculpting, and you can see the result is approximately 2 months later, and you can see a reduction in the amount of fat, and that's a very typical result.
Let's take a look at our second photo.
And in this area, this patient has the picture on the left shows the Coolsculpt picture, and on the right is a post-Coolsculpt. And obviously the patient is not obese or overweight, and probably is a runner, looks like a runner's body, but has a little amount of fat both in the lower and the upper abdomen. Well, so this patient has had all those areas treated.
Okay, and this particular patient looks fit to begin with.
Fit to begin with, but still has a little pinchable fat. And so certainly it can be someone who is fit and has a small roll of fat, or someone who's more average who maybe has a 2-inch amount, 2-inch pinch of fat.
Okay, let's take a look at our next photo.
This is probably a more typical male. So here you see the fat that's around the belt, especially from the back. So this works really well for men, and you can see this patient after having a treatment done. So that means this patient comes into the office, has a treatment done, can immediately go back to work, can go work out, go spend time with the family, and then 3 months later, that's a result.
My goodness, this is really noticeable too. Let's take a look at the next photo.
And so this patient has had treatments before and after. One thing you'll notice is that it doesn't tighten skin. You will reduce the fat, the skin stays about the same. So the patient has appears to have been through some skin stress. That means for most women, it's maybe having a pregnancy.
And possibly some surgery too.
Yes, and so when you have that, you do get reduction in the fat, even though the skin you will not completely shrink back. And so for that, if someone wants extremely tight abdomen, they will need to have an abdominoplasty or a tummy tuck. But if they want reduction without surgery, then this is a great way.
Let's take a look at our next photo.
And again, this is great for
that is a common problem.
It's a very common problem, especially after, when a woman turns 40, 45, 50, even though she's in good shape, good weight, you start noticing this bra fat, either below the bra or above the bra. This is amazing. So for this patient, it was 2 hours, and that's it. She came in one afternoon, 2 hours.
That's remarkable. That's a very short amount of time to have significant results like that.
It is.
Now, how many treatments does somebody generally need to have in order to see the results that we just took a look at?
For most of these results, they just needed 1 treatment session. So for the woman for the bra fat, she had 2 hours of treatment. So she came into the office, had 2 hours, and those were results after the 2 hours. And for the woman who'd had the surgery and who'd had the pregnancy, she had 2 sessions of it. That means initially she came in, she had a session, then came back 2 months later and had another session.
Okay. Now, how long would these results generally last? I mean, you're seeing such a significant change in your body. You would obviously want it to last forever.
Yes.
But what are we realistically looking
So
at?
realistically, so this is a permanent weight loss.
Oh.
That means permanent reduction in fat.
Okay.
So what that means is as long as the patient maintains his or her weight. So if a woman comes in, she's 145 pounds, she's got areas either of her abdomen or flank or her bra fat that she wants reduced. She has a treatment done. It's reduced by 25%. She comes 5 years later, she's still 140 or 45 pounds. She'll still have the same result.
That is amazing.
But it doesn't keep you from gaining weight. So if you gain weight and she becomes 165 pounds, well, she's going to be a little more chubby.
Right. Okay.
Yeah.
Now, what would you say would be the most predominant reason why somebody would have this done?
So the most important reason is people want to see results that are consistent, that don't require surgery or anesthesia or needles or downtime. I think those are the most important reasons someone would use Coolsculpt.
Because what you were saying before is that you can have the procedure done and then you can go do something else.
Immediately,
That
once
is
you leave the
remarkable.
office. Yes.
That is great. Great. Thank you, doctor. It's great to talk to you about this new procedure.